I really thought of making the series of these videos for everybody joining BDS this year. So I get asked a lot of questions which I've noted down here because, it becomes very difficult for us to navigate whether we want to do MBBS or whether we really want to do BDS. I feel, the entire thing where adults will tell you that, you should do what your passion is not valid when you're an 18-year-old and you've just given your NEET exam. How will you know what the career holds for you? So I thought through this video, I'll answer a few questions that have been asked multiple times and maybe try to give whatever I have learned in these very few years as my viewpoint. So the first thing is, ma'am, how is dentistry as a career? Dentistry is a very fulfilling career. Trust me, it was very satisfying when we went to the clinics and, the patient came with pain and they would say, doctor, can you treat it? And then finally, you would be able to, do something for that patient. It is a very fulfilling career, definitely. But yes, there are a lot of challenges in today's day and time in this career, especially because a lot of patients or a lot of clinicians do not respect each other. And pay scale wise, it's not the best career option to choose in today's day and time. However, if you have something in you, you will definitely make your mark in this career because it gives you a lot of independence. It gives you a lot of time to be able to do what you want to do. So I personally feel that this career option will only make sense if you believe in yourself and eventually create your own path. Ma'am, subjects in first year. Yeah, so we have 4 subjects in first year. You have to study anatomy, which is basically just head and neck. If you're in India, you're only going to study head and neck in most colleges. Some colleges will teach you neuroanatomy also. So, the thing is that an MBBS student is going to study 4 volumes of anatomy. But as a dental student, we are just going to study 1 volume of anatomy, but we have to study it in a lot more detail. Apart from that, the subjects that we have are dental anatomy, histology, which is basically, the anatomy of the teeth. Honestly, even I laughed when I heard about this subject because I was like, what are we going to learn about this subject for a year? But, this subject will tell you that one little tiny tooth also has so much. Like, everybody around will tell you, yeah, you're a dentist. What are you going to do here for 5 years? But this subject will tell you, listen, there is enough to study for 5 years because you go in so much of depth of just each tooth. And it's really something that I personally feel that is a great subject. Apart from that, you have biochemistry and physiology. Now, you give only 1 paper for this. Although these are 2 different subjects, you're just going to end up giving 1 single paper. And each of that paper is going to be for 35 marks. They don't expect you to go a lot in depth for these subjects. But I personally felt that had I gone a lot more in depth, it would have been easier for me later when I had to apply core concepts of that subject into another subject. So, yeah, those are about the subjects. Third is how to study in first year. It's different from 12th standard because you don't have to study and rote learn and so many things, like in 12th standard, you have like physics, chemistry, biology, and you're trying to like compete with your friends to like get the best marks. But I would say how to study in first year, I think you just build your mindset. You try to open foreign author textbooks, try to see whether you're able to understand them because eventually you will have to open good research articles, good textbooks in order to actually understand the subject. You will see a lot of people around you getting guides and, just opening all these guides 2 days before the exam. But I felt that had I not done that all the time, I probably would have gotten my concepts stronger. And trust me, after BDS, nobody's going to ask you if your concepts are stronger. You will know if your concepts are strong or not. So I would say study from standard textbooks. That's my take. The next question is how to select a college for dentistry. You should look at a lot of parameters. There should be patients in that college because if you have good patients, only then will you be able to practice whatever you did in your preclinical dentistry. But I would say that one differentiating factor would be your teachers. Even if some college has lesser teachers, but the lesser patients, but the teachers are really interested to teach, you will learn a lot more. It's like, less is more because you're doing only 2 patients a day. But those 2 patients that you're doing it so well that tomorrow when you open your own clinic, you're not going to struggle because you got the right guidance. And I think that's the only role of a dental college to actually provide in terms of education, because everything else like your theoretical knowledge is available in books, it's available on YouTube freely, it's available everywhere. So I feel that just having the correct guidance is going to take you from being a normal dentist to being a very successful dentist. One question that I have been asked is, should you choose MBBS or BDS in 2024? Honestly, the healthcare segment in India is like, I have no words, you know. Sometimes I feel, why have I chosen any healthcare field? But it's not anything different. It is about your core skills, right? Each of these careers are very different. Subjects are very different. And what you need or what you will be 5 years later after this course is also very different. So I feel that, you can study a lot about MBBS in terms of, what are the career options? Is that something you personally would like to have in your life? Or would you like to have like your little own clinical setup, have your patients, work on a 9 to 5? What is the kind of life you're imagining for yourself? It really makes a lot of difference if you can think about it and then make your choice in career. Thank you so much.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.